Hi, my name is Dr. Anna S.3.E.36 and I want to talk to you today about post-traumatic growth and recovery. One of the things that can happen in life is that we can encounter people who are truly difficult to deal with. So I want to talk to you about the Antisocial Personality Disorder today. Now this is not to say that somebody has antisocial personality disorder isn't a social being. It can be a little bit confusing in that term. There are a number of different criterion that somebody has to meet in order to be diagnosed with antisocial personality disorder, and it's also known to be related to psychopaths and sociopaths. So I'll talk about those things as well because they're very interested, and I'll give you a link to an interesting infographic that you can look at as well. The one thing I want to say is this is not something that is easily treatable, and if you come across somebody who does have antisocial personality disorder, is a sociopath or a psychopath, although it's possible that they may work through some of those symptoms and make a very intentional decision to behave in a different manner. If you come across somebody with antisocial personality disorder, don't assume that you, with your great behavior and your good attitude and your real deep desire to help, don't assume that you will be successful. So I always encourage people to find individuals to associate with who are truly a good fit for you and what you need in your life right now. So here we go. Antisocial personality disorder. There is a disregard for and violation of the rights of others since at least age 15, and it is characterized by 7 sub-features. 1, the failure to obey laws and norms by engaging in behavior which results in criminal arrest or warrant criminal arrest. 2, lying, deception, and manipulation for profit or self-amusement. 3, impulsive behavior. So this can be just about anything, but you're likely to see somebody who does something and they might not even have an explanation as to why they're doing this thing. 4, irritability and aggression manifested as frequent assaults on others or maybe engaging in fighting. This is not to say that everybody with antisocial personality disorder has violent tendencies, because aggression can come out in many different ways, so they're not necessarily physically violent. 5, blatantly disregarding safety of self and others, so just a sense that somehow they don't need to follow the same rules, and it's okay for them not to be aware of issues around safety or even be concerned with them. 6, a pattern of irresponsibility. So it's like the sense that most of us have is in what way can we possibly be of service to others? I think of things in that way. My tendency is to want to help, and really I think most people on the planet have a desire both to belong to community as well as to be helpful to others. 7, a lack of remorse for action. So this is actually a really important one. If you find that you're interacting with somebody who's really struggles to understand, why they should even care about the impact they're having on another person, that's a pretty serious thing. A person is at least 18 years old before they can be diagnosed with this. They've likely had a conduct disorder present in their history, characterized conduct disorder, before age 15. If there are other complicating factors like schizophrenia or bipolar disorder, it might really undermine the correct diagnosis, so it's not necessarily the case. So the other things to be aware of is that if somebody is a sociopath or a psychopath, then they've definitely been diagnosed, or if not diagnosed, then they definitely have antisocial personality disorder. And the psychopath and the sociopath, although their behaviors are very troubling, they are kind of coming from a different place, really. 1% of the general population are psychopaths and about 4% are sociopaths. It's very interesting because the psychopath and the sociopath have a lot in common. They both, as I said before, suffer from antisocial personality disorder. They both lack empathy, and they both like disregard social rules, and certainly if they've hurt you, it's hard for them to really connect to that, and they tend to not feel a lot of remorse. So now I'm going to go back to this issue about what's different, because I think one of the most interesting things that separate the psychopath from the sociopath is that the psychopath is likely to be educated and even maintain a good career over their lifetime. They actually seem to be in control, and they're trickier, they're harder to notice. It's harder for you to have a sense of what's really going on with this person, because they may give you a very good explanation for their behavior. They could be very highly manipulative, but they have a hard time really truly bonding with the people around them, or if they do connect to you, that you kind of feel that their story, the backstory, somehow is a little odd. Whereas the sociopath tends to be more reactive, impulsive, likely less educated, probably has a hard time maintaining most social relationships, and may have a very difficult time maintaining a job as well, because they would probably come across as kind of with quite unusual behaviors, may even look like they have stress or feeling anxiety when they're interacting, and they're likely committing crimes that they are being caught for, whereas in the case of the psychopath, they're more calculated. So they're trying to figure out how to kind of get the best outcome for themselves, regardless of the impact on other people. So we will make sure to give you the link for the infographic on this. And this is Dr. Anna S.3.E.36. Have a gentle day, and choose well those you connect with.
For more Ask Dr. Anna videos and information about post-traumatic growth and recovery, subscribe and like our YouTube videos at What is PTSD, or join us at previous video episodes in our playlist Ask Dr. Anna from the Traumatology Institute team.